I've just said, health care reform, the major package would not be done through reconciliation. That would be unreasonable. But that's not going to happen here.
What were you going to say, Congresswoman?
Well, I think that on the reconciliation issue, if they had the votes, we wouldn't have had the summit. And if they try to go through reconciliation, it will be a change in semantics. Instead of the American people saying stop the bill or kill the bill, it's all going to be about repealing the bill. That's not the kind of discussion that they want. And when we were talking about the expanded Medicaid coverage, we rolled the dice on this in Tennessee over a decade ago and made the gamble that near-term expenditures could be offset by long-term savings. The savings never materialized, and that's from a Democrat governor in our state. And as we have all watched it, savings never materialized in Tennessee. They didn't materialize in Massachusetts. They didn't materialize in Maine. It is not going to yield the savings that you're expecting an expanded coverage program to yield.
Let me just throw this in, because I'm not sure the White House has the same understanding of this that you do, because the woman, Nancy DeParle, who is kind of in charge of Medicare over there at the White House, health care over there at the White House, said this morning on Meet the Press, she thought that an up or down vote would be the way to go on this. So obviously she's talking about trying to do it through reconciliation, Senator.
I'd say this to you, Bob. I have said all year, I am chairman of the committee in the Senate. I think I understand how reconciliation works and how it can't work. The major package of health care reform cannot move through the reconciliation process. It will not work.
It will
not work because of the Byrd rule, which says anything that doesn't score for budget purposes has to be eliminated. That would eliminate all the delivery system reform, all the insurance market reform. All of those things the experts tell us are really the most important parts of this bill. The only possible role that I can see for reconciliation would to be make modest changes in the major package to improve affordability, to deal with what share of Medicaid expansion the federal government pays, those kinds of issues, which is the traditional role for reconciliation.
Let me just go quickly around the table here, and we literally have about 20 seconds here. Senator Coburn, do you think at this point that health care reform of some sort is going to pass, or is it dead?
I don't know the answer to that, Bob.
Okay. Senator Hoyer?
Health care reform that they have on the table.
I think so. You said some form. I hope a comprehensive piece of legislation passes because the American people want it, notwithstanding what Senator Coburn says. They don't like the process, but they want reforms.
The people do not want it.
All right.
Well, we have to do it. We have to do it because we're on an unsustainable course.
All right. Thanks to all of you. Back in a minute.